is Dr. Jennifer Bahr. I am a naturopathic doctor, and I'm here with Jody Putnicki, who is a PANS Pandas mom extraordinaire. We are the mom and doc duo who is on a mission to educate the PANS and PANDAS community about the healing power of homeopathy and advocate for the children and families who are really suffering with this difficult journey, as well as teach the world about homeopathy. So, small goals, right?
Just little stuff.
So you're getting a little bit of a taste of a thing that Jody and I do together every Friday in this Facebook group that we have. It's a community of now over 7,000 people, which is both amazing and heartbreaking because it's great to see so many people coming together and heartbreaking that so many families need this support. But it's a Facebook group called Homeopathy for Pans and Pandas. And every Friday, Jody and I do what we call a mom and doc talk. And so we thought that for Pandas Awareness Day, that we would do a version of our mom and doc talk that gives you just a little bit of a taste of what we do, but also gives you some information and education about what Pans and Pandas is, as well as homeopathy, since there's so much talk about homeopathy when it comes to treating and helping kiddos recover from PANS and PANDAS. So if you want to join the group in the conversation, especially if you think that you have a child who has PANS, join us. We're just search for Homeopathy for PANS and PANDAS on a Facebook group, and we'd be glad to have you. It is limited to parents who children do have PANS or PANDAS or who suspect PANS or PANDAS, just because it's also like a community support group. But we've got some news that we'll share at the end, but let's start off with a little bit more about, who we are, what PANS and PANDAS is, and then a few things that people would really love for you to know if you're dealing with somebody who has PANS and PANDAS, whether it's in a classroom, a family member, maybe a patient, if you happen to be a healthcare provider that somebody sent this to you. So yeah, before we dive into that, I'm going to tell you a little bit about who I am and the practice that I run. I'll let Jody tell you a little bit about herself, so you can know where we're coming from, and then we'll dive into like the really meaty stuff. So as I said, I'm Dr. Jennifer Bahr. I'm the founder and chief medical officer of Resilience Naturopathic, which is a practice that's focusing on the homeopathic treatment for children who have PANS and PANDAS. We have a total of 13 doctors, including me. All are naturopathic doctors who specialize in homeopathy and working with kiddos and families who have PANS and PANDAS. So we really, really know what we're doing. We have some great results that we're really helping a lot of kiddos get a lot better. So we're excited to share some of that stuff with you. Jody, I think that's really enough about me. I mean, we could, if you want to know, like I likely had PANS as a child. So I'll just share that with you guys right up front. I likely had PANS as a child. I'm too old for it to have ever been diagnosed because it was not clearly defined until I was too old for it to have met the criteria. But when we look back at my history, there's a reason that I connect with all these kids. There's a reason I understand what they're going through. And it's because I actually likely had it myself as a child. If you want to know more about my story, I spill all the dirt about my story in the PANS and PANDAS group on Facebook. I have like an hour-and-a-half video that shares all about my experience of recovering from what was likely PANS as a child that turned into and was diagnosed as a mental health condition as I was older. And that homeopathy was what led to my recovery. So if you want to know all the dirt on me, feel free to join our group and check out that video. Jody's got a much more interesting story, especially as it relates to this topic with PANS and PANDAS Awareness Day. So Jody, why don't you go ahead and tell people a little bit more about you?
Well, first I have to say, with the whole like advocating theme that we have going on here, I love that you're an advocate and you shared your story, because that's how I found you, was by your own personal story. And that's how, I made the connection and was like, okay, this is going to be my doctor. So I'm just a regular old mom. I live in Texas. I have 2 kiddos, and they are, well, I have 2 kiddos and a stepson, and great, wonderful, awesome kids. And unfortunately, my 2 girls both have had their medical struggles. But our story has a very happy ending thanks to homeopathy. My older daughter, Avery, was my Pandas and Pans child, and I'll tell you a little bit more about her journey in just a minute. But I just am a mom that has been through this nightmare of having a child with Pandas and Pans and going through just jumping through hoops, trying to find treatment for her, trying to figure out what was wrong, trying to manage symptoms, all of the things. And, you know, this has been years ago that we went through it. My daughter's been recovered almost for 2 years now, I'd say. I think coming up
Is
on
it
two
that long?
years. Mhm.
It's
Yeah.
amazing.
A solid year and a half, a little bit over a year and a half, almost two. Anyways, you know, we were so blessed to have, you know, come to Resilience Naturopathic and been able to, you know, experience healing not only for my pandas and pans child, but for my entire family now. And you know, there, back when we were going through it, there's so little information on pandas and pans. We could not even figure out what was going on. We couldn't get a diagnosis. Doctors don't know, the general public doesn't know. So it's important. It's really important to me. I know it's important to you, Dr. Bahr. It's important, you know, the mom or dad that shared this video today, it's really, really important to them that you know what pandas and pans is, and not just because our families are experiencing it, because there are so many families that are going through this nightmare right now. You know, there's not just a couple of hundred of us. There are thousands and thousands and thousands of us experiencing this. And so it's important for us, that you understand what pandas and pans looks like. Maybe you understand a little bit more about it, so you can, you know, be supportive and compassionate to the journey that we're on. But I'm glad everyone is here and listening, and I hope you guys hang out till the very end, because I really want to talk to family and friends and just teachers, just everyone at the very end. So Dr. Bahr, I'm going to let you jump into, you know, more information about what exactly is PANS and PANDAS.
So we're going to try and keep this a relatively short video. If this is something that you guys really want to dive in a lot more about, I got to tell you, Jody, like I said, she's got a really remarkable story with her daughter. She's been through the ringer, and she also spills her guts in the Facebook group. So you're going to get a much longer, more robust videos in the Facebook group if you wanted to get more information. So the PANS and PANDAS, the reason that we use both of these terms, so PANDAS technically is a form of PANS. It's just a very specific form of PANS. So PANS stands for Pediatric Acute Onset Neuropsychiatric Syndrome. PANDAS stands for Pediatric Autoimmune Disorders Associated with Streptococcal Infection. And I know I talk fast. I tried to slow it down. Hopefully that came through clearly. It's a mouthful, you know. So basically what happens with PANS and PANDAS is we have an autoimmune response in the body where the body responds to an infection. In PANDAS, it happens to be strep. In PANS, it could be any environmental trigger. So it could be allergic triggers. It could be chemicals and solvents. It could be mold. It could be Lyme. It could be mycoplasma. So other types of infections as well. So something that's triggering an immune response that's misdirected. So basically, instead of just attacking the infection or the pathogen or what the body perceives to be a pathogen, it also turns and starts attacking the nervous system. Some kiddos are going to see an overnight change. That's what a lot of people are looking for, is that overnight change. It's not always going to be overnight, though. In fact, there was a study done by Stanford that showed that only 40% of kiddos who actually met the criteria for PANS or PANDAS had an overnight change. So just because it's not overnight does not mean that it's not actually an immune system problem more than a mental health or behavioral problem. And I bring this up because the symptoms that you're going to see can look behavioral, and sometimes it can be really hard to hard to catch, because it can look like things that you could excuse away as being developmentally appropriate or just a phase that they're going through. And in fact, I can't tell you how many parents, probably my mom, was told, oh, this is a phase, it will pass. So a lot of the symptoms that you're going to see, they can include OCD. Usually that is a relatively quick onset, like where the kid didn't have OCD and then now they do. But it could also be building up, or you might not recognize that it was actually OCD that was occurring. You know, the child doesn't necessarily tell you, I'm doing these things that make me, that I'm anxious about it, I look anxious about because I have these thoughts that are intrusive and scary to me. So OCD, anxiety, tics, restrictive eating, emotional ability, rage. Oh my gosh, so much rage with some of these kiddos. Depression, aggression where they're actually becoming violent with themselves or other people around them. Behavioral and developmental regression. We'll see 10-year-olds start acting like they're 5. They'll start talking in baby talk. They'll lose their ability to actually do things that they used to be able to do. Their coordination fails. They can't tie shoestrings anymore. They can't, like, their writing suffers because of the impacts on the nervous system. We see deterioration in school performance as well. I mean, these kiddos can like go from being able to read chapter books to not even recognizing letters or forgetting words, and just really like cognitive blunting. We'll see sensory sensitivity as well. We'll see like a sensitivity to sounds, to lights, to odors. You can see hyperactivity sometimes. This can potentially look like ADHD. You're often going to see sleep issues. A lot of times there's going to be sleep regressions too. So they can't sleep alone anymore. They're afraid to go to sleep. They can't sleep through the night. Lots of nightmares, bedwetting, because it affects the urinary system as well. You can see involuntary urination during the day. So a fully potty trained child who's night trained and day trained suddenly having accidents in the middle of the day or throughout the night. You can see choreiform movements, much like Sydenham's chorea. There is some connection to how these things occur in the body. And then intense separation anxiety and school refusal a lot of times for these kiddos. It can get as bad as to have hallucinations for some of these kiddos as well. And then you're going to see other physical signs. You might see headaches, stomach pain, joint pain, etc. So it's really a full system, very complex condition. The tics are going to look a little bit different than they typically look with like Tourette's, which start with simple tics, so like a very minor looking like very short single movement. A lot of times these tics will just explode with complex movements that take longer. So sometimes kiddos can hide them by dancing. For those of you who have kiddos who love Fortnite, I don't love Fortnite because it can actually help hide tics. Like they're doing all those dances that they do on Fortnite. Like some kids will like do them to hide tics that they're doing. So there are things that these kiddos can do that will almost hide what it is that they're experiencing. It can also be really challenging because they recognize a lot of times what's happening. You know, they can't control it, and they'll tell you they can't control it, and they'll feel remorseful sometimes, usually remorseful after the fact when they do settle down. But it can be frustrating for parents too, because you see that they can control it in certain circumstances and they can't control it in others because they're working so hard to hold it together. So it's why you're probably going to get a lot of people, you know, you may have said it to somebody else. If a friend or family member sent this to you, you might think that they're just having bad parenting and they just need to be stricter on their kids. And that's not necessarily the case. So I think I've talked enough. Jody, you're the mom. You're the one who has been through the ringer with Avery and come out to tell the tale on the other end and put this in your past. But I think people are going to understand it maybe a little bit more if you actually tell what it's like to live with these, what the experience is actually like.
Yeah. Okay. So I had a perfectly healthy, happy, she had just turned 5 years old. She had no developmental delays. No, everything was on time. A really not a fussy baby, not a difficult, very compliant, very empathetic, loving child. The only thing that I did notice issues with was her immune system wasn't working so great. But she would get sick and back and forth, back and forth. And right whenever she turned 5 years old, the first thing that I noticed just kind of start all of a sudden one day was picking her up from her pre-K program. She would have these massive meltdowns the second we would get in the car. And it was like, okay, this is a really rough phase. You know, we're going to go through it for a week or maybe 2, 3, however long these phases last. And so we kept going on, and the level of intensity of these meltdowns would get worse and worse and worse. And then I started noticing that they were happening when we were transitioning, like when we were transitioning from, you know, getting out of the house to get in the car to go somewhere, it would be a massive meltdown. And then all of a sudden, we weren't just having meltdowns, we were having meltdowns about putting on shoes and pants. And then really, you know, a little while later, we started noticing that she was having these problems with friends at school. And, you know, I was there to observe a lot of the time on the playground where she was saying that she was having issues. It was after school when we play. And these things that she was explaining to me that she thought was happening were not happening. She just thought everyone was mad at her. She thought everyone hated her. And then from there, it just progressed. She went into a profound sadness, a sadness that I've never seen anybody experience. She was sad all day long, every day. She was crying. She was having, she started having really, really bad separation anxiety to where she could not be in a different room from me. I had to be with her all the time. She could not sleep at all. It was impossible for her to get to bed without me being there with her. And it would take hours and hours. And then if she would wake up, she would be awake for hours and hours. She had restrictive eating where she was not wanting to eat certain foods because she was afraid they were going to kill her. She started having tics. It started with one tick and it moved to, like, I would say we had 4 or 5 ticks at a time. At one time, she had weird neck movements. She had constant finger movements, constant stomach aches. She would tell me 100 times a day that her stomach hurt. Um, she loves to read. Reading is her favorite thing in the world. All of a sudden she couldn't read anymore.
Mhm.
She couldn't write. She would try, but she couldn't. She would kind of fluctuate in between ADHD hyper child
Mhm.
and hyper focused child, to where she would get it stuck in her mind that she had to finish these projects. For her, it was writing books. And she had to finish these books, and she couldn't do anything. She couldn't eat, she couldn't sleep, she couldn't anything. Um, OCD that I didn't recognize as OCD because it doesn't look like hand washing or tapping or whatever, you know, what we think associate OCD to be with. Avery was obsessed with reading Bible stories. She had to read them all day long, every day. She had to read them to me specifically, and I had to understand them. And if she felt like I didn't understand them, she had to read it again until I understood it. She was obsessed with the speed that I was driving at, the, you know, traffic signs. She had to say every single speed limit sign, every single one, all the time for months and months on end. Something was way wrong with my kiddo, and nobody knew what it was. I knew that this was not the child that I had had a couple of months before. Set out to try and figure out what was wrong. I got really lucky, and this is why advocating is so important. I got so lucky because in the beginning, I just happened to tell a friend, and she's like, you know what? I have this neighbor, and her son is going through something that sounds a lot like it, and her son has pandas. And so I went from there, went home, read about pandas, and was just a sobby, bawling mess because I was reading my child. Um, Went to all of the doctors. Nobody acknowledged what I was talking about. Nobody wanted to test. Nobody knew anything about pandas and pans. Getting treatment was an absolute nightmare. And so we literally spent an entire year trying to figure out all of the things. Thousands and thousands of dollars worth of blood work, you know, doing the Cunningham panel, doing all of the things, none of which really gave us any answers or gave us any real definite direction as far as treatment goes.
Yeah, it gave you a lot of answers, but those
Yeah,
answers
well,
gave
yeah,
you a lot more
answers, yes. We learned stuff, but it didn't change anything treatment wise. So that's what we were doing. We were blindly going at treatment. We were throwing antibiotics at her left and right. She would get better on the antibiotics. The symptoms would go away. But then as soon as she would get off, the symptoms would come back. And each time we put her on antibiotics, got her off, those symptoms would come back worse than they were before. So the further we got into it, the more escalated. We started to see rage and violence and anger and intrusive thoughts and just a slew of other things that she was experiencing, and it just kept getting worse and worse. With all of the you know, mainstream medical type treatments, So we hopped into functional medicine because it kind of seemed gentler, and Avery's, her stomach was so messed up from all the antibiotics. I felt like that was
I'm going to ask you to pause for just a second, just so we can really quickly touch on what some of the mainstream treatments are, so people who
okay.
are familiar with PANS and PANDAS can have a little bit of an understanding of that. So as Jody was explaining, we often are going to see, we can see a couple of different patterns. We can see a big spike and then a drop off, and another spike and another drop off, usually associated with an infection. Some kiddos are going to have a clear infection before they actually have symptoms. Some kiddos, they have no symptoms of an infection. They just have behavioral flares that actually improve on antibiotics. And so you have to kind of be lucky to get to somebody who knows, like Jody was lucky to get to somebody who even thinks maybe we should check for strep, maybe we should check for mycoplasma, maybe we should check for something else, because this could be what's contributing to it. When we do find that there is an elevated, either a positive strep test, a rapid strep test, or elevated antibodies to show that there's a recent infection or potentially a still active infection, we'll often see giving antibiotics, as you mentioned, and then anti-inflammatories such as ibuprofen, sometimes steroids, and then you can sometimes use antihistamines as well. And so a lot of times people will have this experience that you had, Jody, where they'll see that the antibiotics are like a miracle, like, oh my gosh, my kid is back. And like within 24 hours, sometimes like, oh my gosh, my kid is back. This is amazing. And you would think, okay, this is done. It's forever. We just have to kill this infection. We have to kill the infection and we're good. Some people who are not quite as lucky do end up on antidepressants or SSRIs are especially one of the most commonly recommended to help control the OCD. But oftentimes people don't need to get there because they use the antibiotics and it works. It's later stages that the psych meds are recommended to be introduced. When you get this pattern that you saw, Jody, that you described, you'd use something, it'd be great. And then as soon as you went off the antibiotic, the symptoms would come back and they'd actually be worse. And then, so you're constantly chasing infections, you're ramping up the antibiotic use, you're changing antibiotics, you're using them for longer and longer periods. You're on Motrin round the clock, you're on Benadryl round the clock. You then start looking at all these other treatment options. Did you want to dive into like that high level treatment yet, or you're getting there?
Yeah, no, that's fine. You led me right into it.
Go for it.
And that's really where I kind of made a personal decision that I was at the end of what I felt like were our options. Well, not even what I felt like. We were at the end of our options. The last treatment we did in mainstream medical with Avery is IVIG. And for some people, IVIG works well for a while. For Avery, it did not go well at all. She had a neurological reaction to it, and she was much, much worse after IVIG than she was before. Our last appointment, I think in the mainstream medical world, was one of her specialists saying that basically I needed to accept the fact that she was going to have an autism diagnosis. Because she looked her symptoms looked autistic in nature, and that I needed to medicate her for the psychiatric symptoms that she was experiencing. And I knew that wasn't going to be our story. I knew that wasn't my kid. And I had to do something else. So did you want to add anything to that?
No, I just want to make sure we touched on the IVIG.
Okay. And then after that, dove into the functional medicine world because it was gentler, and I wanted that for Avery's body. I wanted to heal her gut. I wanted to restore some of the damage that I had done with the pharmaceuticals to try and help heal her. And again, thousands of dollars of testing. We learned some really great stuff in functional medicine. It was a good part of our journey while we were in it. Tried every single supplement, anything that you could possibly do in functional medicine. We tried all of them. There were a couple that helped. Most of them did not work. Avery was so complex. All of the things to help detox her body and all of those things made Avery way worse, which didn't make sense because they were helping other kids. And really, we kind of got to almost the end of functional medicine. And luckily we had a PANDAS and PANS specialist that we were seeing in Texas. And after the IVIG and doing, the functional medicine, he's like, listen, he's like, there's not really anything else that we can do for Avery. You know, I can prescribe you antibiotics when she needs them, but as far as what I can do, we've reached the end. He's like, but here, you know, here's the thing. There is this other world of medicine where there is absolutely healing. You're not going to find it here. You have to go off in a place that you don't understand, that you're going to have to search for. You're going to have to look for it. You're going to have to find it. You can heal your child's body.
Yeah.
Now, poof, go find it. And that's what we did, because, you know, even though Avery went back and forth between getting better, getting worse, getting better, getting worse, she was bad. She was really bad at the end. But at the same time, you know, there was a little bit of, I felt like I had control with the supplements that were working. Like, definitely not a normal level of control, but as far as a pandas and pans world, I had some control. So I was comforted in that. And so, you know, the thing is that it didn't matter what I did, she would always go backwards.
Yeah.
I would have that control. She would be sort of all right. And then she gets sick again, and boom, it all blows up
Yeah.
and goes crazy again. And I couldn't figure out, I darn near killed myself trying to figure out what I was missing. And I knew that, you know, we had made it a long ways, but there was a missing piece to this puzzle I was putting together, and none of it made sense. And I finally got it, and it made complete and total sense. My very first call that I did with Kyle with resilience, he started to explain to me about susceptibility.
Mhm.
And you know, really at the time I didn't quite get it, but I did understand healing the root problem.
Mhm.
It wasn't until almost the end of AV's treatment process where I understood susceptibility. So I want to talk to pandas and pans moms right now about what it is that we're missing whenever we're trying to figure out all the things, and we're trying to you know, get treatment for our kiddos, and why we're stuck in this symptom cycle of getting better and then getting worse and better and worse. So I'll let you take it away and talk about susceptibility, because you're the one who made sense to me. So you tell us about it, and then maybe I'll bring some mom sense into it.
All right, I will try my best, and I'm also going to try to keep this relatively brief, just because we got a lot of things that we want to talk about. We want to make sure we have time to talk to family members about some things that parents would like you to know, and things that we think that families need to know as well. But this is a really important concept, is the susceptibility piece, and so. When I'm interviewed by people for like podcasts or webinars or things like that, or when I've taught at conferences to naturopathic doctors or other providers, this is the thing that people get so hung up on. We want to figure out what's going on. There's like you said, test, find the infection. We got to kill the infection. The thing is, we can't ignore the fact that these infections are having a different response in these kiddos than they would in other people. So it's not specifically the infection, it's how the body is reacting to the infection. And even within the realm of pans and pandas, we're not going to see the exact same reactions to these kiddos to even the same infection. So it's not like if you have strep, you're going to have this, and this. If you have Lyme, you're going to have this symptom, this symptom. If you have Bartonella, you're going to have this symptom and this symptom. There's some attempt to cluster and say, this is a Bartonella picture, this is a Lyme picture, this is a strep picture, this is a mycoplasma picture. And it doesn't pan out that way. Some kiddos are going to be a lot more anxious and have really strong OCD with strong compulsions. Some kids are going to have intrusive thoughts and anger. Some kids are going to respond to those intrusive thoughts with depression. Some are going to be angry. Some are going to be anxious. The manifestations that they have are going to vary even when they meet the same criteria for having that same diagnosis. And that's really where the key of susceptibility is. It's how the body is responding to it. I think it really helped it click for you, Jody, when I said, well, Jody, you've had these infections too, right? You've had mycoplasma. Did you have the same symptoms? Did you end up with compulsions to read Bible stories and intrusive thoughts about what would happen if you didn't? Did you have rage that you got aggressive and violent? Like, No, you didn't, because you didn't have that susceptibility. Your susceptibility was to have a cough and to have a slightly elevated temperature. And so it's that susceptibility. That's the same reason that we're looking at, right now, this is 2020, when we're recording this video, we're 7 months into a pandemic. It's the reason why some people get the same virus and have a really intense set of symptoms. And some people have mild symptoms. Some people have none at all. Some people have mild symptoms, but they last forever. Some people have symptoms that are mild, but last for a few days. It's that susceptibility. It has to do with not just our environment, not just our genetics. Those do play a role. We're always looking for it, like especially in functional medicine, we're looking for the answers. What's genetics? What's environment? The answer is it's everything, and it's still also not that. It's also susceptibility. And I see this because I see identical twins with the exact same genetics and the exact same environment. One twin has it, one twin doesn't. I see families where all of the children are adopted from different parts of the world, different families, and all of the kids have it. So it's not just genetics, it's not just environment, it's both, and it's susceptibility. It's how we respond. The thing that really treats that susceptibility is homeopathy. It's treating that individual reaction that we have to that particular bug. And this is also why with homeopathy, we can see the opposite of what you saw, Jody, where you saw escalating. Every time you would change the antibiotics, the next time that things, when they stopped responding, things got worse. With homeopathy, we see the reverse trend. We see that each time we make an adjustment with the homeopathic remedy that we're recommending, we see symptoms get better and better. And so the regressions are less severe and less intense, last shorter time, over time, until they actually like completely diminish, right? And the reason for that is we're actually helping that body have a more normal response or a more typical response to infection, so that it's not having that susceptibility to this atypical reaction. So we can't just keep chasing when we keep chasing the infections, we're missing this piece. And that's why we feel like we're on this constant antibiotics, anti-inflammatory supplement merry-go-round that you just can't get off of.
Yep. Yep. And go ahead.
Well, I was going to say we are running a little short on time. And so I wanted to shift gears so that you can tell people some of the stuff that you really want friends and family to know when it comes to Pans and Pandas.
So, there's so many. Pandas and Pans is so difficult and devastating to our families. It is a nightmare every single day. We're at our wits' end. We're sad. We're tired. We need help. We can't find help. Just so many things. If you are a family or friend, a family member or friend of someone that has a child that is experiencing this nightmare, they, more than anything, they need grace, because life is hard right now and everything has to be different. In Pandas and Pans, your life revolves around managing all of these symptoms and trying to find help for your child. Seeking treatments, trying to find a doctor that even believes us, and doesn't accuse us of making things up or imagining things or having Munchausen by proxy.
So many Pans and Pandas parents have that accusation.
Yes. And it's like another layer of devastation on top of what we're going through in our home every single day. It's nonstop. And even though this is what I want you to know personally, the mom that shared this video with you, she needs help. She's not going to ask for help because it's just so confusing and it's hard. And
she's learned by asking for help that sometimes help isn't there, and that she might actually be accused of something, that she's a bad parent, that she's crazy, that there's something wrong with her when she asks for help. So moms learn to like just shut it down.
Yep.
But they need help. They need help.
These families need help, whether it being coming and watching kids for a little bit, or coming and allowing her to take a 30-minute nap, or cooking a dinner, or doing a load of laundry, or anything. More than anything, what a family going through Pandas and Pans needs from you is unconditional love and acceptance and understanding and support. This family is on a mission to try and heal their child. And all they need from you is support. It's not a, like you were saying earlier, Dr. Bahr, it's not a bad child. It's not bad parenting. There is something very, very wrong with our children, and we know it, and we're going to fight until we figure it out. Again, I got so lucky to be able to go through this journey of healing with my Pandas and Pans daughter. And now she is fully recovered, doing amazing, great immune system. She can get sick, she can get strep and not get Pans and Panda symptoms. She can be exposed to mold, and she does just fine. So many amazing things that I learned about this journey, going through it. But you got to love these families while they're going through this, because it is a nightmare. And I tell Avery's story because it's our story, but it's not just our story. It's every single Pandas and Pans family story. We experience symptoms, their symptoms are a little bit different, but our story is so many people's story. Like, we literally lost my child. She was gone. And I didn't know for a year that there was something that could heal the root problem. And once I got to that thing that healed the root problem, it changed her susceptibility. And now she's a happy, healthy child. So good stuff. I'm going to hand it over to you.
Well, I was actually going to ask you to share just a little bit about some of the stuff that we're working on, because I already touched on one of the things we wanted to talk about was how homeopathy can actually help break that cycle of the symptoms and that merry-go-round, because it's working on that level of susceptibility. And I'm sure that there's a lot of questions that people have about what homeopathy is. And one of the things that I think that is important to recognize too, from the parent's perspective, is that homeopathy is not well understood because it uses very small doses of natural substances found in nature that are recommended on an individual basis based off of those unique responses that we talked about, those unique ways of reacting to the infection rather than on the infection itself. So, the kiddo who is scared and anxious and really restless and has tics where they blink their eyes a lot is going to be given one remedy, whereas a kiddo who has rage and explosive anger and is very destructive and has terrible constipation and horrible migraines as a result of the same infection is going to be given a different remedy. So it has to be individualized based off of what people are experiencing. And it's given in very, very dilute, very safe doses. And that can make it a little bit hard for people to understand, both that you are not treating and to like kill and suppress an infection, you're working on helping reduce that susceptibility, and that the way that's recommended is just very different than the way we see things in conventional medicine. Because like I said, we're used to like trying to kill and suppress, and this isn't kill and suppress, it's nudge and nudging the body to do the healing that it's supposed to do on its own. That typically, if you don't have that misdirected immune response that your body can do on its own, if you don't take anything, like we're dealing with a pandemic right now, most people don't take anything and they recover just fine because their body is able to kick into gear and do the work that it's supposed to. When we're dealing with PANS and PANDAS, that's not happening. Homeopathy nudges the body into that right direction so that the body is able to have that appropriate immune response, which is why, like you just shared, Jody, your kiddo has all these triggers that she used to have intense, horrible flares from, that now she has a typical reaction. So, mold isn't great for anybody, but some people have really intense reactions, whereas some people have very mild to no noticeable reactions if it's a mild exposure for a shorter period of time. Whereas before, like, you knew if there was mold in a building because you walked in the door and you could see like things change for your daughter. She got strep and she had typical strep infection symptoms, not a PANS flare, right?
Yep.
So homeopathy can be a little bit hard to understand. It's going to be too much for me to go into here. So if you are interested in learning more about it, that's why we put the group together, because Jody was called because she was, I gotta say, you got really fortunate that when you were given that recommendation from your conventional and functional doc that they said, we're at the end of what we can do, you got to look for something else. They gave it that recommendation to the right person, because when you and I first met, I was just impressed with the extent, the level that you went to try and make things work, to make the world a safe place for your family and for your daughters. And you went to the ends of the earth for them, literally. Like, you did beyond what I could ever have imagined a mom being able to do. And I've always been really impressed with you for that. And the reason that I also say that beyond just like you having that fortitude to do that work for your family and for your daughters, you are the type of person that once you find an answer, you want to give it to everybody because you love so fiercely that you can't imagine other families experiencing what you have if you've got something that you can share with them.
Mm-hmm.
And so because of that, you started sharing with everybody about homeopathy. But people have a lot of questions that you're like, I understand it from a mom level, but you're asking really good questions that I don't have from like that doctor level. So we put together this group, like I said, I mentioned at the beginning, Homeopathy for Pans and Pandas. The entire purpose of this group was formed to teach people about homeopathy. So we do have a mini course where we teach everybody about Pans and Pandas basics, about homeopathy, what it is, and even touch on some of the functional and conventional approaches. So you can just have a really good conceptual understanding of all of the ways that people will go about treating pans or pandas. So you're welcome to join that if you want to learn more and go through that short mini course. It did evolve into a group that has also become a massive support community for families who are going through recovery. So it's a learning group and it's a supportive group that would be happy to have more members for if you in fact need it. So that's a place to go to learn a lot more about homeopathy. Just know that it is safe, it is effective, and while it's hard to understand, it's one of the things that I think, Jody, you'd like to touch on sometimes is that you don't necessarily need people to understand homeopathy. So maybe you want to talk about that really quickly, then we can let people know a bit about what some other things that we're doing that they could potentially get involved in. And then we'll wrap it up so people can get back to their very busy days.
Yeah, no, and I was thinking that about that as you were talking. I will be the first person to stand up and say that homeopathy is confusing as heck. I 100% did not believe in it when we started it. But for some reason, I just felt like it was the right thing to do because healing the root problem made sense to me.
Jody, I didn't believe in homeopathy when I first started medical school or when I tried it for myself either. So I get it.
Yeah. And then going through this process, trying to explain it, it doesn't make any sense. You can't really explain it. I'm years and years and years into homeopathy, and I still, get stumbled up on explaining it somehow. But all I know is it works. It works really, really well. And it works really, really well on my child who had pandas and pans and Lyme and mold exposure. And you're right. Like I had this thing, that this knowledge of something that I watch completely recover my child. I had to I literally lay awake at night on a regular basis and think about the moms that are still stuck in this. And it is still devastating to me that there are so many families who are fighting to get their children back. And it's so important to me that Pandas and Pans families know that homeopathy is a treatment option. It's a great treatment option. It's gentle, it's slow. It is not an easy process, but it is producing long-term symptom relief for children. It's amazing stuff. And so like it's evolved over the last 2 years, but this drive in me to, number one, educate the Pandas and Pans community about homeopathy. But not only that, I want everyone, like I want the whole world to know about homeopathy, because if I would have had homeopathy from when Avery was born, I have a pretty good feeling that this would have never happened, because her body, that immune system that wasn't working, would have been working a whole lot better, because I would have been able to heal it and change that susceptibility as she was growing. So I want everyone to know how amazing homeopathy is, not just the Pandas and Pans community. So it's my goals of educating the world about homeopathy just keep getting bigger and bigger and more ridiculous. But that's why I'm so excited about the projects that you and I are going into here in the next couple of months to get that whole outward education process started.
So when we first started working together in a professional capacity rather than a doctor-patient capacity was about a year and a half ago now, actually, when I reached out to Jody and I realized that we both had similar goals, between my experience as a child and then as an adult dealing with the things that I thankfully recovered from with homeopathy, and then working with the communities that I worked with, and then seeing all of the passion that Jody had and the work that she was doing to help spread information, and so many people coming to see me because she had shared with them what her healing recovery would look like. I said, you know what, one of the biggest challenges is when we're dealing with really complex illness for these kiddos is that we've got doctors over here who are sharing, do this, do this, do this, and here's all of these things, and here's all the science behind it. And here's the mom who actually oftentimes knows more than a lot of these doctors because they do all the research. And so they're up to everything. So they've got one patient to think about. So hopefully the doctor is listening to mom and learning more from that. And so then the doctor's saying, well, here's all the research, here's all the things I want you to do, go. And it's tough. It's giving little kids big pills. It's putting little kids on really restrictive diets. It's having them take massive amounts of supplements and having parents like fight these fights. And so I was like, maybe what we would really benefit from to help really make a difference for these kiddos is to have a mom and a doc doing it together. So we can give the doc's information and then the mom's reality, and how to actually take those things and synthesize them together to something that can actually lead to recovery. So Jody and I connected and decided we were going to write a book together. Life intervened because the need for supporting these families in this community dictated that we needed to expand to bring more doctors on to really focus and specialize in working on this. So we were meeting the needs of the community, and I paused to have a baby too. So the book was put on pause. It is no longer put on pause. We are actively working on it again and anticipate that we will wrap it up. We're going to be honest with ourselves, being, doc and both mothers and all the work that we have to do, probably going to be about 6 to 8 months or so before we're able to completely wrap it up. But we're working on that so that you have more information about all of the details about what to expect on a journey that if you suspect PANS or PANDAS in your kiddo. Jody, what else do we want to talk about that we're doing?
I'm drawing a blank. Just more outward educating of family members, of medical professionals. We have this really cool thing that's happening right now where all of a sudden we're getting referrals to the practice from other medical providers who are realizing that homeopathy is a good treatment option for PANDAS and PANS when they have exhausted all of the avenues that they have. They're referring patients, which is great that we can combine it, and providers are seeing so many kiddos that are treating with homeopathy healing and their symptoms completely going away. So I know we'll have some more education for providers as we move into the future. I don't know what else.
So we're going to be educating, doing some more educating for providers, whether, there's conferences that I speak at, grand rounds that Jody and I speak at together, and potentially working on a provider training so they can actually learn more about what homeopathy is, and how it can be utilized in conjunction with what they're doing. We're also continuing to train more naturopathic doctors to specialize using homeopathy and naturopathic medicine. We're taking some of the work that we've really been doing focused inward on our Facebook group and bringing it outward. And this is the first example of something that we're bringing outward so that we can share more information and give more to the world about the stuff that we have been talking about in the Facebook group, so that there can be more opportunities for learning for more people, no matter where you're touched with PANS or PANDAS. Because believe it or not, most of us are touched by somebody who has it, whether you know it or not. It's a lot more prominent than you realize. And then just, we've got lots of goals to go beyond that as well. Just, especially having such a large group of docs who are making such an impact on so many lives, to be able to help collate that data and help provide more information to just increase the understanding of PANS, how it works, how homeopathy is working with these kiddos, and helping more families get to recovery. So we got a lot of big lofty goals. We're really working on things to, like I said, to help support the families, but then by extension, their friends and their further extended family as well. Because like I said, this affects everybody. This affects the society as a whole too. Mm-hmm. So we're hopeful that we're going to be able to take the impact that we've already had on all these families that we have in our community and the Facebook group, and just expand it beyond that. And so if this video resonates with you in any way and you want to connect with us to help us on this journey, or if you want to learn more about PANS and PANDAS, you're welcome to join the group. Again, it's free of charge. Nobody's going to sell anything to you in there or anything like that. It is for learning and for community support. It's Homeopathy for PANS and PANDAS in the Facebook group is the name of it. And it's not and spelled out, it's and little and sign. And other than that, if you are interested, if you don't want to join the group, then that's fine. If you're somebody who does not have a child or suspect that you have a child, we are going to be continuing to populate this YouTube page or this YouTube channel with more information that you can share and to learn more about as well. So feel free to go ahead and subscribe to the channel as well. That's
Oh yeah, podcast too.
Yeah. We're gonna, so basically we're gonna, yeah, exactly.
So many projects.
We'll be having a podcast come out in the next couple of months, most likely. I think we have an exact timeline, but look for that as well. We'll let everybody know when that comes out. If you want to be informed when the podcast is ready to launch, just make sure you join us. So in one of those places, either on YouTube or in our Facebook group, and we'll make sure that everybody's informed. Any final thoughts that you want to share, Jody?
Just want to send big, huge hugs to every family that is in this right now. Just keep fighting, keep taking those baby steps, and keep working to, towards healing. There is absolutely hope for recovery. My child is living proof of it. So just keep going, keep doing what you're doing, and just sending you big, huge hugs today and every day.
Yes. And if you're not a family member who is not a family who's dealing with this, but you're somebody who loves somebody who's dealing with this, give them a hug. Mm-hmm. Give them some support, help them remember that this can pass, this will pass. It's not forever. Okay. All right. Thanks for hanging out with us for a while. We went a little bit longer than we expected, but just for a heads up, if you joined us on any of our videos, that's what we do. We've got so much to say. We end up talking longer than we expect to, and we just, we're who we are. So, all right. So I hate to say happy PANS and PANDAS Awareness Day, but it's not really a happy thing, but
the awareness is happy.
Having more awareness is happy, and the outcomes that we will have from more awareness is happy, because it's going to lead to happier, healthier, more stable kids.
Yep.
All right.
Perfect.
Take care, everybody.
Bye, guys.